The world did change. It changed on March 12th.
It was the day one of the most extreme measures against COVID-19 went into effect.
We are advising British Columbians against all non-essential travel outside of Canada, and that includes the United States.
That means no quarts of milk in Bellingham, no trips to Disneyland.
In the weeks and even days leading up, the risk was still low and life felt normal.
Right now, I don't have any indication that there is ongoing transmission of COVID-19 at any other care homes, but I think travel within Canada is still very safe, and certainly here in BC, it's very safe. At the moment, I do not feel there's a need for us to close schools across the province.
But it all changed after March 12th. Groups of 250 were banned. Now it's any gathering of more than 50. Schools closed, restaurants sit empty, salons shut down, all of it even taking BC's top doctor by surprise.
In my 30 years of actually working on pandemic planning, never actually thought I would ever implement things like travel restrictions and closures of schools.
So what happened? Dr. Henry says as cases spiked in France, Spain, Germany, it became clear the global threat was growing and Washington state was worrying.
We've had patients who, within an hour's time, show no symptoms to going to acute symptoms and being transferred to the hospital. And we've had patients die relatively quickly under those circumstances.
Dozens of people were dead, 10 care homes infected, and the message from American health authorities was clear. The disease was widespread, and it was showing up in BC.
More measures could still be implemented. Ontario and Quebec has ordered all non-essential businesses to close. Curfews and lockdowns are in place in the U.S. But here, at least for now, the ask is still stay home and keep your distance. Leanne Young, CBC News, Vancouver.